Hi guys, this is going to be another OPD video, and today I'm going to be talking about endoscopy. I really enjoyed being in endoscopy after being in 4 weeks in the outpatients, because endoscopy really runs like a day unit, it runs like an inpatient unit, although the people coming are outpatients, but you still kind of have to go through that kind of admission and doing their clinical observations, and they're under anaesthetic often. So what endoscopy is, just to explain, is camera either going down the mouth into the stomach or going up the rectum, and which is colonoscopy, and having a look at the colon. And it was really interesting. I learned a lot about the different medications that are used, and how that procedure works out, as well as being able to do observations on adults, because I did a lot of it on the ward, but mostly on children, or we work with older children, we work with kind of 16, 17-year-olds that are pretty much adults. But it was really interesting seeing the difference, and really interesting seeing the anatomy of the colon as well, and seeing from inside. And I thought I wouldn't like it, I thought I would find it disgusting, but actually I found it really interesting. And it was a really, really good time that I was able to kind of be in theatre and seeing that. And also what I really liked is having time, because often the nurses were doing the observations and the medications, although I got to do some of that also. But the patients were often really, really scared. And because we'd seen it done before, we knew actually it wasn't as bad as the patients often thought it was. So I really liked being able to reassure them. I really liked being at their bedside, because they're awake during the procedure, so just holding their hand and kind of comforting them, reassuring them, communicating with them. I really liked that side of it, because when I was on the ward it was just so busy, you didn't really get that much patient communication, so I really enjoyed being able to do that. The one thing I didn't really like was watching the endoscopies where it's down the throat, mainly because the patients were gagging, and it kind of made me feel like gagging. And it was one of these procedures that couldn't really be explained because it was so uncomfortable. It's done really, really quickly. It's kind of in and out. Whereas a colonoscopy takes longer, and the patients are a lot more comfortable. So there's a lot more the doctor can explain, and we can see the anatomy. And they showed me like posters and things of it, and it pretty much looked exactly as it did on the poster, which is really interesting. It's kind of like up the rectum. It's kind of like caves and lots of passages and things. It's really interesting to see, and kind of like the illnesses they're looking for as well, and having getting information on that also was really, really good, and I really enjoyed my experience there and being able to be there. So that's pretty much all I can tell you about endoscopy. Subscribe to my channel, comment, and I'll see you in my next video. Bye!